Good afternoon. My name is Michaela Etheridge, and I'm a student nurse at the University of South Alabama's College of Nursing, and this is going to be my injection site video for skills. So first thing I'm going to do is show my ID and scan the room. All right. So the first one is going to be the dorsal site. It is found over the dorsal muscle, which can be seen by moving and flexing the patient's arm. This one is a intramuscular injection. It is going to be found above the deltoid insertion, and it is going to be below the acromion process, and it can be found by moving the arm. So it's going to be 3 fingers down from the acromion process, and above the insertion you're going to make a V with your fingers, and that V is going to be the insertion site. And since this is a intramuscular injection, it's going to go at a 90-degree angle. The next one is the dorsolateral. It'll be on the lateral portion of the arm. It is going to be below the deltoid insertion, which can be found by feeling the deltoid muscle, and it's located in the midline of the upper arm. So this is going to be located 3 fingers above the olecranon aspect, which can be found by bending the patient's elbow. So 3 fingers up from the olecranon aspect, and 3 fingers down from the deltoid insertion, and you're left with a rectangle. That rectangle is where you're going to inject. This is a subcutaneous injection, so it is going to be at a 90-degree or 45-degree angle, depending on the length of the needle and the depth of the subcutaneous tissue. So now I'm going to get you to lay down on your back. So the next one is the abdominal. It is going to be located 2 inches away from the umbilicus, not going above the costal margins, not going below the pubic area, and not going past the anterior superior iliac spine, which is the most forward portion of the iliac crest. It is a U shape. It is the most preferred for subcutaneous injections because you can give so many in different sites. You'll use 3 fingers and locate 12 different injection sites. Since this is subcutaneous, it is going to be given at a 90-degree or 45-degree angle, depending on the length of the needle and the depth of the subcutaneous tissue. So you can put your shirt down and roll on your side for me. So the next one is going to be the ventrogluteal. It is going to be found by on the patient's hip. You are going to locate it by finding the greater trochanter. Can you bend your leg for me? And moving the leg so you can find the greater trochanter. For this one, your sites are going to be, you'll put the heel of your hand on the greater trochanter, have your finger pointed towards the pubic area, have your index finger on the anterior superior iliac spine, and your middle finger towards the iliac crest. You'll have a V shape made with your fingers, and you'll feel the muscle to make sure that it's good. So V for ventro, and this is the most preferred spot for intramuscular injections, and since it's intramuscular, it will be given at a 90-degree angle. And the last one, I'll have you lay on your back for me. So the last one is going to be the vastus lateralis. The vastus lateralis is going to be located on the lateral portion of the thigh, It is also going to be found by the greater trochanter. So you're going to have the patient move the leg. And you'll find the greater trochanter. It is going to be located on the lateral portion of the leg right here on the thigh. You are going to have a hand's breadth away from the greater trochanter and a hand's breadth away from the knee. And you are left with this rectangle. For this portion, you will not go above the farther than the anterior midline or below the lateral midline. So you'll have this rectangle here, and most injections are given in the middle third of this, but you do have the entire rectangle in case you are receiving multiple injections. This will be for intramuscular injections, and so that means it will be given at a 90-degree angle, and that is all.